Some 30 million Americans are living with diabetes, and doctors say that number is growing. Diabetics face lots of decisions every day to help manage their condition. That means every meal, snack, and insulin injection must be carefully considered and accounted for. New technology and artificial intelligence can help empower people to better manage their condition. Dr. Robert Rogursky is the Senior Medical Affairs Director of Medtronic Diabetes, and Dr. Tina Moen is the IBM's Deputy Chief Health Officer. Thank you guys so much for joining us this morning.
Thank you for having us.
How is artificial intelligence help people improve their condition?
Artificial intelligence being applied to healthcare problems is really all about surfacing insights from the vast amount of data available to help patients take better care of themselves.
And so when it comes to managing diabetes, we mentioned some things there, eating properly, exercise as well. How can artificial intelligence help them to do that a little bit better?
Yeah, so what the artificial intelligence does is takes this wealth of data that are generated from patients with diabetes. So you mentioned their eating behaviors, eating habits, their exercise, their insulin injections, and all that is generating data that then can be used by the IBM Watson Health Analytics to provide some insights for the patients. The basis for the insights is glucose or blood sugar, and glucose in this case is being streamed to your phone and then to the cloud from a glucose sensor, a small filament that sits under the skin and generates a glucose level every 5 minutes. So as you can see, if you have the every 5-minute data, you can get a lot of information, and you need very powerful analytic engines that IBM has to be able to provide insights about that data.
Now this sounds like very personal data also, and how important is it for diabetics to have this personalized data at their fingertips?
Well, every patient is different. Every patient reacts differently to, for instance, the same meal. We've had patients who have been told to eat peanut butter as a snack or to drink juice to correct low blood sugars. And in every instance, that patient's response may be different from the next patient's response. So this kind of information is what allows the analytics of the artificial intelligence to provide personalized information for the patient.
Now with medicine, we're always looking forward, always looking to improve. How do you guys see this improving in the next 5 years or so from now, the management of diabetes?
Well, I think if we think about the evolution of technology in any industry, the rate at which it's evolving is exponential, and so the same thing will happen with technology in healthcare. We're in the beginning stages of artificial intelligence in healthcare, and so as we sort of progress along this journey, in 5 years we'll be able to apply more advanced algorithms, and surface up more buried data, if you will, and find patterns and connections for patients and caregivers to take better care.
And where can our viewers find some more information?
They can find it on the Medtronic Diabetes website and through the IBM Watson Health website.
Thank you guys for joining us this morning.
Thank you.
Thank you.
And a special thanks to IBM for sponsoring that segment.